Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Can coffee consumption negate harmful effects of sitting too much? BMC study unveils association. A recent study published in BMC Public Health has unveiled an association between sedentary lifestyle and coffee consumption. According to the authors, sedentary behavior for more than 6 hours per day, along with no coffee consumption, is strongly related to increased risk of mortality from all cause and cardiovascular diseases. Sitting for longer hours is independently linked to harmful health outcomes, including cancerous, metabolic, and cardiovascular diseases. On the contrary, coffee consumption is believed to have protective effect on all-cause and cardiovascular diseases mortality because of its antioxidant qualities. In the current prospective cohort study, researchers studied the combined effect of daily sedentary time and coffee consumption on death from all causes and cardiovascular diseases. Data of 10,639 participants was collected from the National Health and Nutrition Examination Surveys conducted from 2007 to 2018. Personal interviews, physical examination, and lab tests were conducted for each participant. Global Physical Activity Questionnaire was used to measure total sitting time per day. On basis of the questionnaire, 4 groups were divided: 0 to 4 hour, 4 to 6 hour, 6 to 8 hour, and more than 8 hours per day. Based on total reported coffee intake, coffee consumers were divided into no coffee intake, 0.23 to 326 gram per day, 326 to 540 gram per day, and more than 540 gram per day. Combination immunotherapy shows increased survival and antitumor activity in bladder cancer cases. Findings from the international 4-2 clinical trial showed that a combination treatment, including immunotherapy, is safe and tolerable in patients with locally advanced or metastatic bladder cancer. The results, which were recently published in JAMA Oncology, show potential to broaden the number of patients with bladder cancer who could benefit from immunotherapy, an approach that harnesses a patient's own immune system to fight cancer. The tumor microenvironment plays a critical role in predicting response to immunotherapy. Tumors with a T-cell inflamed microenvironment, which are characterized by infiltration of CD8 plus T cells, chemokines, a group of proteins that help in migration of immune cells, and an interferon signature, respond well to immunotherapies and are associated with improved survival. In urothelial bladder cancer, increased T-cell infiltration has been correlated with longer patient survival. In 2016, we published studies showing that the tumor with FGFR3 mutations have no T-cell infiltration, which led to the logical conclusion that blocking the FGFR pathway could make more patients responsive to immunotherapy, said Swiss. Novel blood test promises timely diagnosis of diabetes in kids. A new study from King's College London, published in Nature Medicine, reveals a new type of blood test using lipids could make it easier to identify children at risk of complications around obesity, including type 2 diabetes, liver, and heart disease. The findings also contest the common idea that cholesterol is a leading cause of complications around obesity in children, identifying new lipid molecules which contribute to health risks like blood pressure but are not only correlated with a child's weight. Lipids have traditionally been thought to be fatty acids in the body, either good or bad, types of cholesterol or triglycerides, fats found in the bloodstream that is the most common in the human body. Recent studies from the same group of scientists have suggested that the picture is more complex. Using a technique associated with chemistry called mass spectrometry, current evidence puts the types of different lipids present in the body in the thousands, each with separate functions. Taking a control sample of 1,300 children with obesity, the team addressed their lipids in blood. Afterwards, 200 of them were put on the whole-bake model for the year, a lifestyle intervention for people with obesity popular in Denmark. Subsequent readings showed that amongst the intervention group, count of lipid tied to diabetes risk, insulin resistance, and blood pressure decreased, despite limited improvements in some children's BMI. Can pregnancy transform a woman's brain? A Nature Neuroscience study highlights. A new study has revealed that the brain undergoes major changes during pregnancy, some fleeting and others more enduring. Researchers for the first time have mapped the changes that unfold as a woman's brain reorganizes in response to pregnancy based on scans carried out at 26 times starting 3 weeks before conception through 9 months of pregnancy and then 2 years postpartum. The study documented a widespread decrease in the volume of cortical grey matter as well as an increase in the microstructural integrity of white matter located deeper in the brain. Both changes coincided with rising levels of the hormones estradiol and progesterone. The scientists said that since the study's completion, they have observed the same pattern in several other pregnant women who have undergone brain scans in an ongoing research initiative called the Maternal Brain Project. They aim to expand the number into the hundreds. It's pretty shocking that in 2024 we have hardly any information about what happens in the brain during pregnancy. This paper opens up more questions than it answers, and we are just scratching the surface of these questions. Crystal added. The scans showed a reduction averaging about 4% in grey matter in roughly 80% of the brain regions studied. A small rebound postpartum did not return the volume to pre-pregnancy levels. Kidney stones. Pushing fragments could be key to reducing recurrence risk. UW medicine researchers found that patients who underwent the stone moving ultrasound procedure had a 70% lower risk of recurrence. The Journal of Urology published the findings. I think the main takeaways of the study are removing fragments reduces relapse and using a non-invasive handheld ultrasound device to help clear these kidney stone fragments, said UW medicine urologist Dr. Jonathan Harper, the study's senior author. The multi-site randomized controlled trial was conducted from May 2015 to April 2024. Almost all of the 82 participants were from the UW medicine or the VA Puget Sound Health Systems. All had stone fragments that had persisted in their kidneys for months, and the ureters were free of stones and fragments. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.